So is my screen visible?
Yes, sir, it's visible.
Okay, thank you. And I'll just full screen. Okay, so I'll be discussing this trial. This basically this study, which was published in Translational Oncology by Ashwin et al. From Tata Memorial Hospital and ACTREC. And this is basically looking at weekly osimertinib dosing prevents EGFR mutant tumor cells destined to home mouse lungs. So I'm not able to move the slides actually. Yeah. So a bit of background. So we all know about ADORA trial, which showed that osimertinib, when given as an adjuvant treatment in daily dosing in stage 1B to 3A lung cancer patients, adenocarcinoma patients who are EGFR mutant, has a significant disease-free survival benefit. So this experiment, this study was actually set to establish an appropriate preclinical orthotopic mouse model to extend the implications of ADORA trial by studying effect of pre-treatment with erlotinib, osimertinib in weekly/daily dosing on homing of PC9 cell lines in mice lungs. So this was the design of this experiment. They used 30 immunodeficient mice and divided them into 5 groups. Two groups received erlotinib in daily and weekly doses as pre-treatment, and 2 groups received osimertinib in daily and weekly doses, and one was controlled. They then injected these mice with luciferase-stacked lung adenocarcinoma PC9 cell lines. This is basically a lung cancer cell line which has exon 19 deletion, to assess their homing to the lungs of these mice. So what they did was basically in the group receiving daily dosing, they pre-treated these mice with erlotinib or geftinib starting 3 days before injecting the cell line, and in those in the weekly arms, they gave 2 weekly doses of either erlotinib or osimertinib before injecting the mice with the PC9 cell lines. After injecting, they assessed bioluminescence till day 18, starting from day 1 till day 18 at some predefined intervals. And what they noticed was that in both the osimertinib arm, that is both weekly as well as the daily arms, there was loss of bioluminescence. That means there was elimination of this homing of PC9 cell lines in the mice lung starting from day 3 itself, in both the weekly as well as a daily arm of osimertinib. But on the contrary, in both the erlotinib arms, bioluminescence persisted till day 18 in the weekly erlotinib, and it persisted till day 3, then vanished, and then again reappeared on day 18, basically suggesting emergence of resistance to erlotinib. So, what the authors discussed in this paper was that this efficient clearance of PC9 cells from the lungs with osimertinib, it may be due to a delayed metabolism of osimertinib, and also maximum bioavailability of osimertinib in tumor generation site and lungs. And also, as osimertinib has minimal first pass metabolism, low clearance, and a high distribution volume in humans, this may possibly explain the efficacy of osimertinib in the weekly dosing group. So, authors concluded that EGFR TKI pretreatment in patients can delay the onset of disease in those patients who are receiving osimertinib as adjuvant treatment post resection of early stage tumors, and also in patients who have predisposition to EGFR mutant lung cancers harboring germline EGFR kinase domain mutations. And they also concluded that this low dose once a week osimertinib, if proven to be effective in the above mentioned setting in humans, will have lower toxicity, more affordability, more ease of administration, and also may delay or prevent uh, acquired resistance. So I went back and looked into some early phase trials of osimertinib, and yes, osimertinib is a quite a potent drug, as we can see from these IC50 values, which are quite low for osimertinib in both the PC9 cell lines as well as those cell lines which have a T790M mutation. And this is the graph for osimertinib 20 mg dosing, and we can see that even with 20 mg dosing, we can achieve a steady state plasma concentration. And also we saw some responses even in the 20 mg dosing in early phase trials of osimertinib, which can also be seen in this phase 1 trial of osimertinib published in NEJM. And we can see that the response rate, the overall response rates with even with 20 mg and 40 mg doses in those patients who have T790M mutations were not too bad, 59%. And the 80 mg dose was actually selected based on the 70% response rate in T790M mutation. So my take would be that definitely this experiment, this study is a useful and it presents some useful and interesting insights on osimertinib pharmacokinetics and dynamics. The results are encouraging, which suggest potential efficacy of weekly osimertinib, which may be due to its irreversible inhibition and the other reasons which the authors have mentioned. Definitely, if it can be translated, if this potential efficacy of weekly osimertinib can be translated in humans also, then definitely more patients will benefit. But whether these results can be translated in humans is actually yet to be seen. And it would also be interesting to see what will be the efficacy of intermittent or maybe weekly or maybe a lower dose of osimertinib in established tumors. This particular study was actually to see the homing of PC9 cell lines. So that setting is a bit different. But what will happen in established tumors, we don't know. Maybe further such experiments and studies will be able to find out. So that's all from my side. Thank you.
Thank you, sir.